please.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you everyone for being here. This is a little bit unusual because of the holiday. Getting everything squeezed in and get it done. So, everybody had a chance to review the minutes.
So moved. Second.
Favor?
Aye.
One.
HE1 is a resolution to reclassify 2 early intervention specialists to senior early intervention specialists. These positions will supervise the current early intervention specialists within the division. This reclass will create a line of succession within the children with special health care needs. This is the only division that does not have this step up program. Thus, it should increase staff retention. These reclassifications are budget neutral due to the vacancy that we have within the department, which is a special ed administrator position. The position also remains eligible for partial reimbursement from the early intervention grant that we receive. I'm requesting from a grade 10 to a grade 12 in the CSCA.
I'll make the motion.
A second. Is there any discussion or questions? Richard?
How many employees are there in this group of people here?
All together,
Give or take.
9.
And who oversees those people at this juncture?
The director.
And these 2 promotions, I take it's a promotion.
It is a promotion.
Okay. It's gonna take 2 of the 9, correct? Am I assuming that's correct?
No, that is correct.
Okay. So each one's gonna have 4.5 people to,
No,
one's gonna have how many to run?
1 is a team. So there's 1 senior and then 1 that does the visits. So the other one will free up some time to make some phone calls, to do the video conferences with the schools.
Who does that now?
The director,
Okay.
and it's a lot. And yeah, it's a lot.
I mean, I understand what you're saying about budget neutral. And I hate that term because usually it comes back and bites us right in the derriere.
Next
No
year,
sites
well,
of derriere, guys.
next year, there will be an increase.
All right, because,
Right
what
now,
is it? Go ahead.
No, right now it is budget.
Yeah, because
neutral,
one's
so
a
the remaining-
$4.03 increase, and the other one's $4.67.
And that's because one has been with the county for almost 30 years.
God bless her, she won't be along forever. But, and I'm sure she's doing a great job, wouldn't
She is.
want to replace her. The only thing is, when we do these type of promotions, we're married to it. And we're stuck with that cost going on and on. And the thing that just really caught my eye, and I hate this term, please don't put these in here, thus increasing staff retention. So it's like we're saying, we can't keep people, so we're gonna pay them, we're gonna promote them to pay them.
Well, it's for the younger ones to have something to strive towards. To keep the ones that are the newer staff that are the early intervention specialists. It gives them something to look forward to. So they're willing to stay with the county after they gain all that experience, after they've already put in their time. We can always fill a position at a lower, we can always fill that position at a lower position. The seniors don't have to be filled as a senior. It can be filled as a specialist. But the senior gives them, they can oversee the case, they're still gonna have a caseload, but it's like a mentor that they have someone to go to. It's a team approach. kind of like what we do in our environmental division, where it's more of this team is working on these school districts, this team is working on these school districts. That's what it is.
That was essentially the same question I had, was about that. But with that, you see that in the 2024 budget, to maintain this promotion, it will affect the 2024 budget. Will those two positions, you plan on replacing those early intervention positions?
No,
No.
these are to take over those two
Okay, so
early
I'll stay at 7 then.
Yeah.
All right, thank you.
How much of this is partially grant funded? You mentioned it was partially grant funded.
Yes, this is, you want to help with the
I
early
believe
intervention?
one is 30% grant funded, and the other one, I believe, is 17% grant funded.
This is our mandated program, and
Yeah.
it's odd, it's very odd billing.
It is a discussion at NISAC every year. Every year there's a resolution. Phil sees it coming out of children with special needs over this particular problem. The state does not do a good job picking up their end of the bill. They shut this off on the county years ago, and it's still there. But every single year, there is movement and an effort to try to get them. And once in a while, they move up a percent or something like that. But they don't take the responsibility for it. And there's a huge caseload in this county.
There is.
All the upstate counties are just lambasted with this. They seem to take care of the metros a little bit better than they do us.
The real push is, I just want to make it fair through all divisions, where there is a stepping program, where so staff feel they have something to strive to.
Makes sense.
If they could be a senior, I do it with the nurses. I have senior nurses, some of them are filled at RN levels, but the seniors, they're just in case.
Anything else? Right?
So, one, I applied for what you're doing here. But is it, the girl that's been there 30 years and she just
Almost there, yeah.
and she just getting moved up to a senior? Okay. I myself, me, I've always pushed for a higher rate of pay for the rank and file, to be able to maintain them and be able to get people to come in here and say, okay, I want to work there because of this.
Right.
Okay, it's a great place to work, but I'm getting an excellent salary also. So I applaud you for what you're doing here. Okay? And I think it is a way of saying, okay, well, I can't, give you a raise at where you are right there, but I can if I move you up. And it gives other people that are lower. But the thing that bothers me a little bit, it took one girl 30 years to be able to get to there. Okay, I would rather see it come a little bit quicker, even though they may not be supervising people. Okay, it's still, we have to change the category a little bit because I'd rather see them get, and worry about the 2024 budget. We don't seem to worry about that when we're handing out $109,000, $120,000 to people from other counties to come in here and work, and yet we have somebody here that we're going to move them up just a little bit, and I applaud you for it. Thank you very much for what you're doing. Thank you.
One more question. With this 30, with this 30 years, sir, how close to retirement is this person?
Oh, no,
You just had in there.
she's not. She's still
Mentioned.
very young and she wants to continue on.
Okay.
I haven't heard any chatter of,
Terrific.
I think that this is, for me, I see this as someone who doesn't want to micromanage people, which is a good thing. You're allowing your people to think outside the box on their own and be able to, work with each other and manage with each other. So that's a good thing.
Yeah, I'm in favor also from the aspect that it relieves the director from attending all of those, and there's 8 to 1,000 meetings a year.
yes.
That's a lot.
That's
That's
pretty
a lot.
amazing.
So they'll resume some more responsibility, absolutely. Plus supervise another staff member that's right under them. And they are newer staff, the ones that come in that are early intervention.
Richard?
We're losing one of the Indians on the front line, correct?
No,
So these two people are still gonna have a caseload to work with.
that's correct. Plus oversee the other one so they can take on more. Yes. I think it's a good restructure. That probably should have happened long ago.
We should talk about it earlier.
Any other questions?
Another comment.
Go ahead.
I'm surprised that this makes up 65% of the whole health department budget,
Yes, it does.
just for this area.
That, for this division, yes.
This division.
It's a very expensive program that's
So that's-
mandated.
Right, it's not mandated.
They do great work. I wish we had more therapists.
And it's not to be misinterpreted here, but years ago with NISAC, Oswego County at one point, didn't we have somebody on every damn committee?
Yeah.
And that was one of the goals back then, was caucus sat down and said, we have to have a voice that carries on. And I'm on two of them. I'm on children with special needs, public health, mental health. And I got on the committees for two reasons. Both of them were health related. One, because I'm an advocate for the disabled. And a lot of these children are under OPWDD and that type of programming. And so it gives us a voice. And I know it's a little bit of an advertisement here, but if you go to NISAC and you're not on the committee, you really need to think about doing that. Because Oswego County at one point had a voice on every single committee. Voice ain't always heard, but it's always reported that we're there and we're speaking up. And this is a massive, massive program. I think that if people, if you haven't taken a tour of the health department, I encourage it. Don't take a dog, because it will turn into a 2.5 hour walkthrough, but it was great. And meet some of the people, talk about the programs you have. And I think you're gonna have your eyes open a little bit. They do some amazing things over there that, as long as I've been involved in the health committee department, I still go over there and learn something new all the time. So, just a unpaid advertisement there. Any other comments? All in favor?
Aye.
Opposed? Motion carries. HE2.
HE2 is a resolution rewarding a professional service contract for analytical testing service. ALS Group USA Corp. was the only response that we received. They are familiar with Oswego County sampling requirements. They also pick up our samples, so then we don't have to ship them outside. The approximate cost is $581,043. They do benchmark testing for our energy recovery facility, our Hastings asphalt plant, Bristol Hill landfill. They do potable water sampling, enhanced water sampling, private committed facilities. They do a lot, just not for the health department.
Motion?
Motion to discuss.
Second.
Discussion? Richard, go ahead. No, you're fine.
This is environmental issues that you're talking about. That seems to be a real popular subject. Forget what parties are and like that. It has nothing to do with that. And yet, I'm a little dumbfounded, and just dumb, doesn't matter. Why can't we get, isn't there anybody else out there? I mean, we get one response? That doesn't make a lot of sense to me.
Well, we advertise for it and we put it in the newspaper. We also put it on our website, and we did send it to 3 other agencies, and we only received 1 response back.
Has this been the same group each year?
Yeah, pretty much, yeah.
Has there ever been any other responses other years?
I can look into it for you.
The purchasing department would have those records. These are done through the purchasing department,
Okay.
so they would have those records.
Anything else?
Out of money.
It's a lot of money.
Purchasing will also have, when we send out a bid, we don't just send out the bid request. In that bid packet is a non-bidder response. So sometimes the other companies that don't bid will fill that out and tell us why.
That's good to know.
Those are important.
That's good to know.
Yeah.
So, I do have a question.
Yeah, go ahead.
So if we're doing this annually, when we're doing the same color, how much did it go up from last year?
The last time we did it was 2018.
Okay, so it's like a
And
3-year
during that
contract.
last RFP, the cost estimate was $358,233.
Well,
So it's pretty much double. Plus.
Close.
And this contract's for the next 3 years?
But we have to look at the actuals paid to that vendor to determine what it really costs.
Right.
These are
These are estimates.
based on
Right. Okay.
information.
and this is the price for the 3-year contract, not each year.
That's correct.
Okay.
It's not bad.
Yeah, Phil, you oversee purchasing time and deal with that. Is this project considered just too small? Somebody wants to build skyscrapers and you send out a bid to build a 3-bedroom house and they don't want to get involved in it?
Well, no, I think this is, $500,000 over 3 years for lab testing. I don't think it's too small. Plus, all these labs do the same thing for every county. All counties do this.
They do our lab testing for childhood lead program, Bristol Hills, Zip Road, Leachfield, Lynchade.
And it might be, this is just a guess, but private sector's having trouble hiring too. They may not be bidding because of their own staff shortages.
Frank, did you have something?
None of this is state or federally funded in any way to us or anything. We can't get anything from state or federal government on this, or it's part of it.
This is Article 6.
Yeah, we do have some reimbursement for it. The lead grant covers some of the lead testing. The water grant covers some of the water testing. And then Article 6 covers anything else that's environmental related. But it doesn't cover anything related to Silk Road or the landfill or any of the other agencies that this testing goes to. Only health department expense.
Okay. As long as you're getting something from them. They're telling us they want us to have this, that, and everything's safe and everything's sound.
Yeah.
Let's give us some money then. Thank you.
Anything else? No. All in favor?
Aye.
Opposed? Motion carries.
Okay.
Outdoor advertising billboards.
So we did reach out to the COVID Enhanced Detection Grant, and the grant really does require the advertising to be COVID related. So we were unable to go underneath that grant for the RFP. What we were able to do is go under the COVID vaccine grant, which is the CVDVAX grant. And COVID is in the title, but it does allow for advertising for all routine immunizations. So this is our new bulletin board, part 2, that we came up with. And this allows for us to still use this RFP so it doesn't go to waste.
Does it mention the other vaccines by name, like shingles, pneumonia?
No,
It doesn't mention them by name.
it just says childhood vaccination.
We'll cover all those.
That turns into a little bit of a challenge every few years over at the health department where kids go to school their first day and then the next day they've got to line out the door at the health department because you can't go to school without your vaccines.
Yes, and then a month later, they're all getting kicked out, and then we have another line out the
We have
door.
another one. So the money's there, it can be used for this. Will it be effective? I don't know. Maybe this is a test to find out. You know, does somebody come in there, 2 or 3 people, and say, I saw your billboard, I thought you better get it done before school started.
Hopefully. Hopefully someone sees it. Also, on the agenda with the purchasing department, the new grant wasn't added to this. And I just wanted everyone to be aware. The purchasing department is aware of this error, but it's not under the COVID Enhanced Detection Grant. It is under the CVDVAS grant.
So we'll have to change that.
Need a motion to do that or not?
Minutes.
It's wrong on the sheet.
It's
Just
wrong on
change it.
the.
It's wrong on the bid sheet for the funding
It's wrong on the
And
source.
don't you have to change it before we vote on it, or?
We can do that. We can do an amendment. We haven't voted yet, so.
All right, motion to amend.
Second. All right.
I just wanna make sure it's right.
Absolutely. No problem with Frank. Okay.
Okay.
I want to make sure she's got it. You got it?
Yep.
Good?
You mentioned that the word COVID was still needed to appear.
Not
No,
in that.
not in this
Okay, I
one.
was looking over.
I
that.
know
thought
COVID is in the grant
in the
name,
grant, but it's not on here.
that's correct.
Okay, fine,
And it doesn't need to be.
good.
The other one, it had to be.
I want to make sure Frank sees them first before we.
That's right.
Well, we got to vote on the amendment. Anyway. Any discussion on the amendment?
No. I'm
All in
good.
favor?
Aye.
Okay, now we're back to the motion.
I like that one. Yeah, I
They're
like
cute.
them.
We're hoping to use them both.
Passing it on.
Okay, back to the original motion. Any further discussion?
Yeah, how many sites are there gonna be? We got 9 school districts.
They're the ones on the list, right?
There is a list
Yeah,
on the
there's a
back.
list of what it is. Oh, there, it is, right there.
Right.
And then maybe during food season, we can change it up a little, but I'll bring it back to the board.
Oh, so next.
Do work.
Might not be any in Hastings. No, they just don't show up. The first day of school, they didn't get a shot.
Where that line out.
Got the line. Okay, no further discussion. All in favor?
Aye.
Opposed? So the next one, there is a correction.
Landmark advertising, and it needs to say to blow. You want me to go over
Yeah,
that?
I think that, mine's right. Mine does.
Yeah, it says Duke right?
Yeah. Betsy thought that some of them went out wrong because she gave me.
Oh.
That's the- Everybody have Duplo?
Yeah.
Yep.
Okay. You're seven,
Oh,
six.
yeah, I got it. What's the next?
You okay? Okay.
Yeah, it was under who by title evaluated the bid proposal.
Right. Okay. You want to explain it?
Sure. So this is for aerial application of pesticides. We received one response to this bid, which is Duplo Spray Company, Inc. for aerial application of pesticides with a price of $3.78 per acre. In 2022, the price was $3.72, so he is requesting a 6-cent increase per acre.
How many acres do we do?
Depends on the,
Yeah.
depends on where we're getting positive traps, as to how wide of an area it changes every year. We always do have total numbers.
Yeah, it's usually Toad Harbor Swamp and the middle of Claremont.
And you said we could go out on that and we could watch how they pick out the mosquitoes and stuff like that and make those determinations.
Absolutely, if you would like to visit the mosquito station.
Have fun.
We're big high boots.
I know it's crazy, but I just think it'd be interesting to
Yeah.
see, we hear all about it, but just to see how the heck they do that.
So they use rusting boxes and then light traps.
Yeah.
It is a pretty neat process.
And if that doesn't work, Richard goes around and whistles. Calls them in.
I'll pick you up.
We got those trained mosquitoes still.
One at a time. Any questions? Need a motion?
Yeah, I'll make a motion, I got a question.
Second?
Second.
You know, we used to, through, of course, she's no longer there, Peggy Ritchie's office, used to get a grant money for this, for the spraying. Now we have to do,
Wasn't the spraying,
No.
she gave kits.
Yeah, the kits
Yeah,
for,
we get money
and
for
the
kids.
tire disposal program
Yeah.
is where she funded. And the money for spraying is something that the state has budgeted, and we access that if we have to spray.
all right, so that's still in place.
We pay for it first.
We pay for it first, then they
Right,
reimburse
right.
us 50%.
So we get a reimbursement.
Okay.
What, half?
Hmm?
It's about half
Half,
of
yeah.
what we spent there.
Better than nothing.
Okay? Anything else? All in favor?
Aye.
Opposed? Thank you.
Strategic plan review. Everybody received a copy, and I just want to see if anyone has any questions, comments, before I request approval from the Board of Health. But I wanted to review it with you first. Which is Judy.
Is this an annual plan?
No, it goes from 23 to 25. We'll renew it, and this is part of our accreditation process.
Did we change, so we must have had a plan in place?
No,
We did not.
this is our first that I'm aware of.
When do you have to present it to the Board of Health?
I was gonna do it Friday as long as there wasn't too many needed corrections. If there are needed corrections, then I can hold on.
I actually read through this, it's quite extensive. How long did it take you to prepare this group here?
I would say about 6 months. We were working on it a little bit pre-COVID,
Yeah.
getting one established, but COVID came and everything went to a halt. And then it was important to pick it back up when we could. So
It's very extensive.
it is. Our next,
Very descriptive, narrative on all the different areas.
Do you need more time?
Do I need more time? I haven't had a chance to read it yet, but
oh,
I can always get back to you.
Oh, I'll definitely hold off. I don't have to present it to the board, but it is a working document. We can make changes at any time to this. It, actually, we plan to, is as we meet some of the goals, we'll move on and develop new goals.
Quick question. Will this help us in our state funding and things like that? Once we get accredited, or?
It can't hurt.
And Diane's got a good perspective right there.
But it's definitely part of our accreditation process that this needs to be done. We need to have this, we need to be branded. So, and we're working towards all of those.
Accreditation doesn't guarantee anything, but it does open up other possibilities.
Yeah.
You know, the state is going to change what it wants.
Right.
So being accredited is a big asset to that.
I'm gonna ask you a specific question about page 18.
Oh, sure.
It's annual staff survey results,
Yes,
just because I happen to flip through it.
no, good.
And there's two sections that we score low on.
Yes.
One is number 6, do you see a path to advance your career in the county?
Yes,
I think we just took some steps to improve that, right, in the resolutions today. Even more troubling, or not more troubling is number 18. Do you think that work is distributed evenly across your team? And only 58% agree. How are we going to make improvements there?
That's another area that we have been looking at, and this is another way where some staff feel very overloaded. And I mean, with the restructuring, we've been helping with that. We encourage staff that if they do feel overloaded, please go to their supervisor or manager, ask for assistance. No one should be feeling like they're getting burnt out or their workload is higher than another's. So we really have taken steps based on all the answers and sent out emails of how we were going to work these out with the staff. We also have a suggestion box that comes directly right to me. If there's any suggestions, questions, concerns, we have to have open lines of communication. I mean, that really is key. If someone feels overloaded, they need to bring it to our attention because we might not know.
Well, we do tend to overload the people that work well for us, right?
We
And I think
do.
we're all guilty
Yes,
of that.
yes.
When will the next survey come out? This is from 2020.
Every year. So every October I send out a survey.
Okay. So you compare.
Absolutely, me too.
Point out a couple of others in the opposite direction. Do you enjoy the colleagues you work with? Do you enjoy the culture at the health department? 100% agreement. So that's a good. That's good to hear as when you're a director that you don't have a lot of infighting and petty personality differences and things. That makes the work easier.
Seems like they've got great morale.
Sure. Also, number 7 was the same thing.
So as a side note to this, if you've been on this committee any length of time, we've done more recently in, like what we just did today, in working people up, trying to change some of the structure of the committee, or health department. This committee has been behind that, and in any defense, although I don't think there's a lot to defend on this, Vera's not been in that position very long and has taken this on since day one as a challenge towards the accreditation. And you can feel the people as you go through. Again, go visit that department, you're going to get blown away. It's a very positive environment. And not going to go blame any previous, but years ago when I went through, I didn't get that kind of feeling. It was kind of like ledge, us, and nothing works. And that's not the feedback that you get now. So it'll be interesting in October to see that. And I would suggest we hang on to this, and then when we're done, we'll.
Yes, absolutely, please. I mean, that's our plan.
Go ahead, Frank.
A question back here and then comments about this here. Education, they did not include any trade work or people went into trade schools or anything like that? It doesn't say here, it just says bachelor's degree.
What page?
Not on page 11. It's just listing bachelor's degree in order to, a 2-year degree. Does not say anything about anybody going on to trade schools. Did I miss it somewhere else in here, somewhere else in the?
I don't know where you're referring. Can I come over to see what you're looking at?
Education, on number 11, page 11.
I'm on page 11.
And you're looking where it says education.
Education.
And it lists, according to the U.S. Census Bureau, 88% of the people 25 or older have high school degrees, but only 32% have bachelor's degree or a higher SUNY college. Few community colleges, both campuses located in Oswego County. But it does not list people that went to trade schools. Did we not do that, or did we?
That was just not part of the question.
Okay, all right, now, going back to page 18. We've got the yes, no, but what's the other?
That's when they left the comment.
I left a comment, or
Because
they,
they could fill in their own.
So they did not answer a yes or a no.
Yeah, so it might be, maybe, it could be sometime, so we left it open where they could, make comments underneath there.
So the percentage is only up to ones that answered yes and no, but we have a higher number of other than we do no's that I'm looking at. I'm looking at 14 people that possibly were not yeses, so it shouldn't be such a high percentage, yes or no. And don't give me other.
It might have been a blank. I guess what I'm asking is, what does the percentage represent? Is it yeses of the entire sample, or responses within the entire sample?
Within the sample
Okay, so it's of the yeses?
of the yeses.
I think that's skewing it a little bit, because you have 10 people, and the first ones that
Okay.
didn't answer, and then you got 12 and number 2.
Well, the others would apparently be, perhaps they didn't answer yes or no and left a comment,
Mhm.
or they did answer yes or no and left a comment. That's why
Yeah.
you don't add the others into the total of the yeses and no's. They're part of it.
We'll do the same way, exact same way for the next, so we'll get, we're always gonna have it skewed a little. I don't think any survey is perfect,
No, I'm not,
but I think we're just trying to be
I'm just looking at,
consistent.
the actual, how many people did the survey? Was it 25 people, or was it,
Well, and some only
35
answered
people.
1 through 5 and then stopped. Some answered all of the questions plus.
well, it's the same argument that I have with the school district, when the school district's doing their survey, doing their question and answer period, teachers going around telling them, well, answer this way, or answer that way, or no, I don't have to answer it. You can walk out of the room, you don't have to do it. So I'm just saying, I'm not saying your department's good, bad, because I know it is. Okay, I know it's good, okay? But I'm just saying that I'd rather see actuals instead of looking to see that skew it so that we look better than what we are, but we are, I think we're one of the best, I think you got one of the best departments around. I do. So you're not gonna make everybody happy all the time, so. That's just my only point, that's it, thank you.
Richard?
Yeah, there was a comment made, and you have to take a deep dive into this. Do you think that work is distributed evenly across your team? Now, I don't know what these people would think as what team means. Is it the team of environmental, or is it the team as the health department? Or is it team as a single county, 1,100 workers? Feelings are not facts. And how somebody may feel is not necessarily true. How many divisions exactly, and I should know this, but I have no clue. How many divisions are there in your department? You've got environmental, you've got this, you've got that, you've got this, you've got that.
Okay. You want
Give
me-
or take.
We have environmental, we have our finance department, we have preventative services, we have children with special health care needs.
Never mind. Go ahead. Keep going.
Health education and emergency preparedness, which holds our fellows program. That will do it.
All right, so you have 6 divisions, basically. Okay. I might sit here and work in environmental. Just saying hypothetical, because I know most about that, because Hafner and I have had a lot of discussions over the years. But anyway, somebody could look at that job and saying, I'm here every day answering the phone all day long, and I've got the lines ringing and the lights lighting up on my phone, that's no base, and things like that. And Bill's out there driving around his truck from going to Constantia to look at a drain field or whatever the case may be. Then he's got to come back to Palermo, and then he's got to go back up to Central Square, and on and on and on. That's a pretty good gig, because he's got the air-conditioned truck to drive around in, and I'm here, I've got my phone ringing off the hook. So how would they people feel? And they're all part of that unionized situation, correct?
That's correct.
So if they feel that they're overworked or it's not evenly distributed, they could go work a motor vehicle, or they could go work wherever. whatever other jobs we have here that are on that list. So I'm kind of wondering if that number might be skewed. Because I ran into the same problem with UPS because of the fact that I had guys that did industrial routes, and I had guys that drove 180 some miles a day. Well, the guy that's driving around, or gal, it's changed.
I used to drive truck for
You know, you think it's a cakewalk just driving. It's a pain in the ass when it's snow like crazy, with freezing rain. But the
You
thing
used that
is,
word,
the thing
that
is,
derriere before, but you used that word this time.
the thing is, I don't care. I'll go by my First Amendment right. The thing is, that number could be skewed. Because if they're not happy working there, they're gonna quit. There's a lot of jobs out there.
Okay, hang on. It is skewed. We live in a political world. How much do you believe every political survey you see on TV? This is what people feel in a moment in time. There may have been 5 people that got stuck in traffic, were having a bad day before they even got there, they got the survey. It goes on all the time. We go through it all the time in the disability report. ACLIL sends us surveys all the time. They never end up being, you look at it 2 days later and say, I should have answered that way. I mean, it is. It's a snapshot in time. It's not biblical. It's a guide.
One of the steps we did take is we created OCHD Presents. So each division, department, service within that department can come and speak to any staff that has availability during the lunch hour, and to learn about their program and what they're actually doing there, and that includes all staff.
So that's a good point, Ricky, but that's exactly, you're right.
Mhm.
It's a snapshot.
Yeah, no, and I respect it. I think very highly of the health department. I think they do a great job. You guys do. And you don't seem to have the vacancy problems we do in other departments. I won't point them out,
Not
but you
anymore.
don't have that.
That's correct.
So if it was that bad, then you'd be coming to us, look, I gotta hire this, and I gotta hire that, and I gotta hire this. You haven't come here and said that. So, I mean, that tells you a lot right there alone.
Anything else?
I would just say what I've read so far looks very professional and happy to be responsible.
Thank you.
Should have been there the day the Board of Health had to do their part.
For the spot.
You did a good job.
I don't know how many sheets do we have on the walls?
A lot. It's pretty extensive for a health center. Really good.
Okay. Continue. You have anything else? You got a director's report?
I have a director.
Very quick one, right?
Sure.
The pressure's on.
I'll read it.
Should have.
So for strategic planning, everyone received a copy. Hospice, we currently have 2 open bereavement cases. I met with Nessentia, program manager. The contract that between our legal department and their legal department has been signed by all parties. A letter of support was mailed to New York State Department of Health from us. Hoping to move things forward because we only have 2 bereavement cases left. Everything is moving forward, and they are hoping to hear a response from New York State by the end of August. I'll keep everyone posted on how that goes. They've also asked me to sit on the board of directors just until at least they're up and operational, which I have agreed. Health Education and Emergency Preparedness, OD2A. We have an upcoming Narcan training that's been requested by the Mexico Fire Department. We continue to pitch our Leave Behind program with the EMS providers, and we're working on an infographic for reports for the Narcan training program. We plan to continue outreach, education, and training on harm reduction. Our new chronic disease self-management class is starting at St. Luke's on the 10th of this month. We're also doing a new chronic disease self-management at the Gardens later on in July. We will be presenting More Than Sad in July and August for the Fulton School District for their staff development days. The Fellows Program, we are sending 2 epidemiologist fellows to grant writing training. The plan is to add this into their job description. Grant writing is very important. We don't have grant writers, so I'd like to send the 2 EPIs to grant writing, and the fellowship program has agreed to pay for this training. Environmental report, Super Dirt Week. We have a meeting July 11th at 2 p.m., which will be virtual. Our flavored vape shop hearing are being organized for those that were found to be selling illegal flavored products. We did have one mobile unit that was closed because they did not have a valid permit. 2 other food service establishments will be closed down by the end of today if the paperwork isn't finished and turned in. Hopefully that will, they will turn in what needs to be turned in. Our Oswego County Fair ran from 6:30 to 7:02. It was a very successful year. We only had a few incidents that were founded. We had a refrigerator unit that went down, and we did need to waste 1 bin of macaroni salad. It really didn't affect them very much. They had several bins of mac salad in the other refrigerator. And then we did have a campsite that needed to be moved over a little because it was a fire hazard, and we did have to request that they cover the manure because it was very hot out and it got really odorous, so we did have them cover that. HarborFest applications are still coming in, and we're coordinating with the HarborFest committee regarding all the food vendors. Children's camps are up and running, and if they're not, they will be by July 10th. A lot of pre-inspections and paperwork has been done in the past couple weeks. Mosquito season is well underway. We have 4 environmental health aides working with us and 1 full-time employee that went through the training with Dr. Oliver, and they're doing a great job. We've had no negative positive pools yet to date. We did have to cancel the Hastings Rabies Clinic twice due to unhealthy air quality caused by the Canadian wildfires. The new date is scheduled for July 19th from 6 to 8, and we do have another rabies clinic July 12th that is scheduled for the Town Highway Granby garage. Air quality permitting, which is really hard to say, but I hope everybody's not getting too much backlash because of the air quality. Okay, very good. Healthy families, we have a census of 26. That's the highest number that we've ever seen in this program. We're receiving great feedback from OCFS on improvements made to this program. Our subcontractor, CCE, had 1 home visiting staff resign, and then a manager that acts as a liaison. She does about 5 to 10% of her time. Has put in her notice also. They did increase the hours of the remaining staff to 39 hours per week, which gives us the ability to maintain the families that we're having, and also the ability to add families if we need to, which we do need to. There's a lot of need in this community. Our program manager at the health department is also carrying a caseload for this program, and she's not having any difficulty. So continuing on status quo. Preventive services, we have 96 lead cases. That's the children with the lead levels above 5. Our immunization program, new staff finished the IQIP program with the providers. IQIP strategies are designed to support healthcare professionals to identify opportunities to get their patients vaccinated. Starting to plan our back-to-school clinics. We're going out to Hannibal School District on August 16th for a clinic. We're all caught up with the migrant workers. As of now, we'll go back out to the migrant camps and farms around September when the rest of them come in. We continue to vaccinate at OCJ for now. We'll see what happens with that. If we're continue to vaccinate or not. Well, we plan to as long as they want us. Our MCH, which is our maternal child health, our census is 11. Referrals are coming in from Syracuse and Oswego hospitals. One of our RNs has completed 2 out of 3 elements to become a certified lactator counselor and this is all funding from Reach CNY. Our PCA program, we have a census of 52. There's nothing really new to report. Referrals are still coming in. Communicable diseases, there's been an increase in GI illnesses, very normal during the summer months. Our public health and safety team, the next monthly meeting is July 17th. Where Oswego Hospital and our probation department in the county will be presenting on their current program and how to reduce overdoses in the county and their efforts in addressing substance use in the community. And that's all I have.
Any other questions?
Just for Frank, have you heard from any of the folks with the burning, the fires that were having an issue with?
Well,
Miller?
we're thinking about boycotting Canada. I would think, you know, I mean, just because they don't want it, they don't want to send it to us.
Yeah, I don't think I missed any meetings, I missed it, I'm not sure, but where are we gonna stand, or where are we with that dispensary machine over there at cafeterias?
We don't stand. It's done.
Or is that kind of like everybody in the one by one?
No, it's done. A decision needed, they needed an answer.
We went over the
And it's
deadline
fine.
on purpose and that killed it.
Yep, it's fine.
Okay. Well, I don't,
It's fine.
Well, we got lots of
continue to do
information, depends on
education
who
and
gave
training.
it to you.
Yeah.
Yeah, that discussion was, there's a deadline, don't touch it. This committee didn't want to deal with that. We brought it back here, but the deadline came up and you said, don't touch it, it's dead. So. That it?
Adjourn.
motion adjourned.
So moved.
Have a nice weekend.
Thank you.
Oh, we got one more thing?